Today I'll be walking you through the data entry process for the ECMO registry. So by now you should have access to our data collection tool COMET. If your site is already contributing towards our adult patient database or our pediatric registry, then you may be familiar with this platform. If not, I'll be walking you through it today, so don't stress. I'll be using our test version of COMET today, meaning that all data displayed is completely fictional and used for educational and testing purposes only. So once you log in, you should see a case report form tab in the menu bar. If you click on this, select the ECMO option and the eCRF will be loaded for you. To import a new patient, simply click on New Record and you'll be redirected to the data collection form. Once you arrive here, you have one of two options. If this patient is a new patient that has never been entered into any of our current databases, meaning the APD or the ANSPIC registry, then commence filling out the patient demographics as instructed. If this patient is already in COMET, meaning they've been entered into either the APD or the ANSPIC registry using COMET specifically, then you can pre-populate some of their demographics to save you some time. Simply do this by clicking on your hospital. Again, I'm going to be using Alfred as my fictional hospital for this video and click on COMET Record Search. You then have the option to search for your patient using any of these fields. I'm going to search by last name. And once you do that, all patients that have been entered into COMET previously with the last name Smith should appear. You can then cross-check for your patient using the HRN or date of birth. And once you identify your patient, you can click on this button over here to load any of their hospital admission records. So once you have identified the relevant hospital admission record, you can click on this button to pre-populate and load that data onto the data collection form. Always double check that the information is still valid and relevant, and if it's not, you can make any changes accordingly. We then move on to the ECMO specific data, starting with the ECMO initiation date and time. So this is the date and time at which ECMO blood flow was established. Again, you can click on the calendar and select the date, or you can manually type it in. We then want to capture the location where ECMO was initiated, and this is particularly important as we want to capture all ECMO attempts even if they occurred outside of the ICU. We then want to determine the type of ECMO, whether it was veno-venous or veno-arterial, as well as the access and return cannula site. We also want to capture any cannulation attempts without the establishment of ECMO flow. You can then determine the primary diagnosis by selecting from the drop-down menu. If your primary diagnosis is not listed, you can click on Other and search by the relevant ICD-10 code. You also have the option to select as many secondary diagnoses as you deem necessary. We then want to capture any relevant therapies as well as patient physiology and biochemical data that were collected prior to the initiation of ECMO if they are available. We also want to collect any relevant cardiovascular, respiratory, and neurological information where possible. The form then ends by capturing the relevant patient and ECMO outcomes as well as any complications that may have occurred during the ECMO run. Lastly, you can verify and submit. You should get a green notification letting you know that your form has been accepted. If you have missed out on any of those mandatory fields with the asterisks, then you will not be able to submit your data. So it's a very simple process, just a one-page form, but if you do have any questions at all, feel free to jump on our ECMO community on the Slack channel where we'll be able to address any questions that you may have.